my name is Remy Looper, a clinical manager and registered dietitian who specializes in eating disorders and intuitive eating at Doherty Nutrition. Today, I'm joined by Avani, a licensed therapist and inclusive eating disorder specialist. IEDS is not something you hear about very often. Can you tell us a little bit more about this and what made you decide to specialize in this?
Yes, of course. First and foremost, hello to anyone listening, and thank you for tuning in. Treatment of eating disorders is something that I hold near and dear to my heart. So I'm really excited for our chat today. About the inclusive eating disorder specialist credential, it's a formal credential like the CEDS, which is, I think, what most people are used to seeing, the certified eating disorder specialist. But the IEDS is a little bit different. It's intentionally built around an inclusive, weight neutral framework. And it takes more of a like social justice focused stance when it comes to understanding and treating eating disorders. So the training for the IEDS emphasizes approaches that are aligned with things like health at every size, weight inclusivity, anti-diet care, um, what else? Like awareness of systemic factors that impact health.
Mm.
And there's a lot of information about how eating disorders and body dysmorphia show up in oppressed and marginalized communities, how social pressures affect these communities differently, and how therapists like myself can be mindful of that and tailor our treatment approach for these populations. So, yeah.
Yeah, no, that's such an amazing certification. And it
Yeah.
really is something that I wish more people had and more
Yeah.
people even knew about. So that's awesome.
Yeah.
And that really kind of helps tie into what we're going to talk about today.
Yep.
Something that's really important both in nutrition and in mental health care, and that is implementing health at every size and providing inclusive care to all.
No, exactly. This topic comes up so often in our work, I think because so many people have had negative experiences in healthcare and honestly society at large because of diet culture and fat phobia. Um, so I really can't tell you how many clients I've worked with who, delay going to the doctor for years or leave appointments feeling dismissed, like, or shamed or misunderstood. I've had clients say things like, I went in for a migraine and somehow it turned into a conversation about my weight, or I stopped bringing things up because I just knew what they were going to say already. Um, and over time, experiences like that don't just impact physical health, right? They shape how safe someone feels in healthcare settings, but also, like I said before, in general in our society. So, today we really want to talk about what HAES is, or health at every size, what that means, why it matters, and how both therapists and dietitians can work together to provide, better, more compassionate, more inclusive care.
Yeah, definitely. And I think also too to help people who are listening, understand how shifting away from a weight-centered model can actually improve, patient care and trust and mental health and long-term health behaviors. Because like you said, people go in and they go in for one thing and it turns into being a focus on their weight. And so then people
Mhm.
end up just not wanting to go seek health care at all. And so
Exactly.
that's something that we really want to, kind of move away from and explain why, shifting away from that weight centered model can be really helpful.
Hmm.
Okay, so let's start with the basics. So, health at every size, often called HAES, is a framework developed and supported by the Association for Size Diversity and Health. It encourages healthcare providers to focus on health behaviors and well being rather than weight as a primary indicator of health.
Yeah, exactly. And health at every size and the IEDS credential are like this. They really go hand in hand. Hayes really gives us that framework for stepping outside of the weight-centric model and allows us to ask more nuanced questions that capture a more comprehensive picture of someone's health and well-being. I think there's a lot of misunderstanding of Hayes because lower weight has been so tightly associated with health. when we mention health at every size, it can sound to people like we maybe aren't caring about health or that we are maybe promoting a certain body size. But what we're really saying is that weight is a terrible indicator of health. Um, that the healthcare industry boils our overall health down to weight because it's convenient and cost saving, as opposed to, looking at all the other factors. Health and well-being is complex and influenced by so many other things like genetics. I think people really underestimate how much genetics plays a role. I'd say like 20% of things we have control over and like 80% is determined by genetics. But then there's like access to care, stress, our environment,
Mm.
which like air pollution is not great right now. And there's so much more, right? And
Yeah.
what happens is when we make this blanket statement that like lower weight is better, we end up with eating disorders and body dysmorphia. And Remy, you and I are on the front lines. We see the side effects of this very incomplete and harmful way of defining health.
Mm. Yeah, absolutely. And yeah, and I think that's all those things are so important to point out is that it is really complex and misunderstood. And really just the core principles that, HAES is trying to promote is just that weight inclusivity. So just recognizing that there is body diversity and that it exists and that people can, be healthy in multiple body sizes. Um, Respectful care, just addressing that weight bias in healthcare. Everyone has the right to, feel respected when they go in for checkups or, they go and see a therapist or a doctor or a dietitian or a dentist or whatever it is. And, eating for well-being. So encouraging that flexible and intuitive eating. People eat in all different ways and different cultures have different foods and healthy eating doesn't look one specific way.
Mhm.
If you have a cookie or a cupcake every now and then, that doesn't automatically mean that you are not a healthy person. um,
Mhm.
that life enhancing movement, so just promoting enjoyable physical activity. Physical activity doesn't have to, also again, kind of like eating, look a certain way. Any movement is good for our body and we want to encourage that. We don't want people to feel like they need to be in a gym for 2 hours doing
Yeah.
one specific movement. It could be gardening, it could be taking your dog on a walk, it could be swimming around in the backyard in the pool or something. Like just so many ways that we can do movement that's enjoyable. And then just health enhancement, right? So, like you mentioned, just improving access to supportive care and resources. People don't all have the same access. And so, just really trying to improve that and improve the access that people have to healthcare is just so, so important.
Yeah, oh my gosh, I love the example of like gardening as like just a fun way to like move your body or like an enjoyable way. It
Yeah.
can really look so different for anyone.
Mhm.
I really like cleaning, and that's like cleaning is labor intensive, and so, I'm really not a gym person.
Mhm.
But yeah, like I like moving my body and cleaning. So it's interesting how when we view things under this lens, like you really just expand, there's like less rigid rules around things, which I love. Um, I think one of the, biggest mindset shifts for clients is when they realize like my health is not just my weight. I've had clients who are doing so many things to support their health, right? Like eating more consistently, incorporating movement in ways that felt good, improving sleep. That's huge.
Sleep is huge.
Going to therapy. But because their weight didn't change, they almost felt like, oh, none of this really counts.
Mhm.
And there can be a lot of grief in that too, when people realize how long they've been measuring their worth or success based on a number that doesn't even capture like 10% of the picture of health and well-being.
Yeah.
Um, and so when we introduce this framework, there's often a sense of relief, but there's also like so much unlearning that has to happen because we've all been taught our entire lives that weight is the indicator of health,
Mhm.
right? So HAES, health at every size, is really about creating spaces where, people of all sizes feel safe and respected and supported and that safety piece is something I come back to a lot in therapy because without it, people are much less likely to be honest about what's actually going on.
Mhm.
And
Yeah.
this is why, weight inclusive, um, weight neutral care matters so much. I've worked with clients who would spend days, and maybe you've heard about this, Remy, just days or weeks preparing for a doctor's appointment, mentally rehearsing what they were going to say, trying to present themselves in a certain way, bracing themselves for, comments about their body. And like I said, I also have clients who just avoid and stop going altogether, unless something feels absolutely urgent. And then that avoidance makes that avoidance, it makes sense, but it can also lead to things going unaddressed for much longer than they should.
Yeah.
Um, I want to name something here as well because I think it's really important to say that this isn't about, criticizing or blaming healthcare providers. Most providers are also working within systems that make it really difficult to offer the kind of, personalized, relationship-centered care that we're talking about. Appointment times are really short, and there's a lot of pressure and systemic expectations that shape how, primary care doctors or doctors in general deliver their care. So a lot of the time, it's not about intention, it's really about the environment that people are practicing in. At the same time, though, I think these conversations still really matter because there's a gap.
Yeah.
So the goal here isn't to shame providers, and um, I hope people understand that it's really just to increase awareness and create more opportunities for, reflection.
Mhm.
Because if we can all understand how weight stigma shows up in subtle ways and if we can recognize the consequences of weight stigma, it really does open the door to practicing differently. And ultimately, we're aiming to bridge that gap to create environments where people of all body sizes and shapes feel, safe and respected and heard.
Mhm. Absolutely. And I think that's where, coordination of care on our parts as, therapists and dietitian with our clients and their healthcare providers is so important. Just helping to bridge that gap and, helping to have that open communication between the whole treatment team. Um, and we see this a lot in nutrition counseling as well. I have a lot of clients that come in and they're like, I'm so nervous about going to the doctors and getting weighed. And, I'm also just so nervous about even expressing some of these concerns to my doctor. And so that's sometimes where, I'll step in and I'll, kind of have that conversation with the doctor with them. And, we'll even provide, we give little cards that will say like, please do not weigh me.
Yep,
I'm working with a dietitian, and so we'll, pass those out to our clients
I
as
love that.
requested too. And sometimes even that just helps open the conversation between the patient and their doctor of like, oh, like, where did you get this card? And, kind of tell me more about it. And it just helps, spread that awareness. And that's like you said, that's all we're trying to do, like, no shame and and that and everyone's learning. And just trying to spread that awareness and just create a more open and improved health environment in all
Yeah.
aspects for everyone. um,
Yeah, definitely.
and a lot of our patients too, kind of having that thought, they'll come in and oftentimes too they're just even worried about working with us as dietitians because sometimes of just the stigma of what it can mean to be a dietitian. And so a lot of people come in too expecting us to kind of shame them or tell them don't eat this or to lose weight. And that's not what we're trying to do either. We're trying to help support those sustainable health behaviors, just really focusing on that balanced eating and helping them improve energy levels. Like you said, sleep is so important. And sometimes getting enough sleep is not the full puzzle piece. Sometimes it's, yeah, we're getting enough sleep, but we're not eating enough.
Right.
So really making sure that, our patients just have an overall improvement in health behaviors and just even more important, that healthier relationship with food. That one's so important is working on that relationship with food.
Yeah, no, absolutely. First of all, I love the weighing cards or like the don't weigh me cards. I think there's so much anxiety around going to the doctor, and so those cards really take a little bit of pressure off. And then the supporting sustainable behaviors, absolutely. Like I said before, we're on the front lines of this. We see the disordered eating, the anxiety, depression, poor body image, and chronic stress really that occur as a result of weight-centric models. And I think, um, one thing that I often highlight for people, I can talk about this all day, is that chronic stress is not a small factor. It has real measurable impacts on the body. I mean, you can imagine, right, if someone's thoughts are constantly preoccupied by anxiety about food or how hungry they feel or critical thoughts about their body, feeling self-conscious in social settings, navigating stigma and judgment, not only by peers, but doctors as well. I mean, that's some major stress. It's not just a mental experience, it's something that your entire nervous system is really responding to. I hear people talk about how it feels like they can never fully relax, like they're always being evaluated or needing to monitor themselves. And when that's the baseline, it makes it so much harder to engage in behaviors that actually support, health in a sustainable way.
Yeah, absolutely. Oh my gosh, no, you couldn't be more right. I mean, stress just plays such a huge factor, and it definitely is something that's just not talked about enough and how it impacts the body.
Hmm.
I definitely find that with our patients that when we do focus on those other things, so we do focus on you know the relationship with food and stress and sleep and improving those behaviors, um, you know all of their health markers can improve. And that's
Yep.
something that we see a lot where, we'll have improved lab levels, we'll have improved energy levels, we'll have improved mood, and weight hasn't changed at all.
Yeah.
And that's something that is so important to highlight is that it just goes to show, like we've been saying, like having that weight centered model and having this weight centered healthcare, and having weight being a, marker of health, it just doesn't work because we can
Mhm.
have all these improvements in health without seeing the number change. And that's so important for people to start to, learn and kind of understand. It's like, wow, like, yeah, I can have improved, symptoms and regardless of what my weight is.
Yep.
And research has shown that just engaging in healthy behaviors like balanced nutrition and movement and reduce stress and improve sleep can
Mhm.
improve those health markers even when the weight doesn't significantly change one way or
Yep.
the other. So I think this is also just where that collaboration with therapists and dietitians is, and even doctors and just everyone else in the treatment team is so important, because we're the experts on food and nutrition, and you guys are the experts when it comes to the mental health aspect, and then doctors are the experts when it comes to those signs and symptoms of health issues. And so just really having everyone working together is so important to just make sure that we're having just and giving people the best possible care that we can.
Yeah, definitely. No, I mean, best practice really does say that like having an entire team, that includes the dietitian, the therapist, and the physician, is provides the best outcomes for people struggling with eating disorders.
Yeah.
So most of our clients come in with a complicated relationship with food, body image, or dieting history. And so therapy can help address the emotional, psychological, and behavioral patterns behind those struggles. A lot of times I'm helping clients unpack things like perfectionism, fear of judgment, black and white, or like rigid thinking, and a strong need for control, which show up like rigid food rules, cycles of restriction, and binge eating. And I'll often hear clients say, I know what I'm supposed to be doing, I just can't seem to do it. And that's usually a sign that this isn't just about knowledge, it's about what's happening emotionally and psychologically underneath those behaviors.
Yeah. And that's something that I see with, my clients every day. We can help with the nutrition education and the practical strategies like learning hunger cues and building balanced meals or working through food fears. But like you said, so many people are like, yeah, I understand this, but how do I do it? And so, yeah, we're giving them this education, but we're also helping them figure out how to do these things. And it is so much more than just, let's improve sleep or let's get more sleep or, let's make sure we're eating 3 times a day. There's just so much more mentally that goes into it. And so that's, where collaborating with therapists, I find to be just so helpful. And I've learned so much from working and just talking with therapists. So
Yay.
it's all really intertwined.
Yeah, absolutely. When we collaborate, we're able to address, both sides of the issue in a much more comprehensive way. I've seen such a difference when a client is working with both a therapist and a dietitian who are aligned, because
Yeah.
instead of, feeling pulled in different directions, they're getting consistent, reinforcing support. For example, like a client might be working through fear of certain foods in therapy, exploring where that fear comes from, while also working with a dietitian to gradually like reintroduce those foods in a structured and supported way. So I love that like nutritionists really do, and dietitians really do provide like sort of like an exposure experience, which is nice.
Yeah.
Or a client, might be learning how to tune into hunger and fullness cues with a dietitian, while in therapy, we're addressing the sort of anxiety or mistrust that comes up when they try to listen to their body. So that combination really allows for like insight and the actual like action,
Mhm.
um, which is where a lot of meaningful change happens.
Yeah. And, this can be especially helpful and important for people who, have eating disorders or they've experienced chronic dieting in their life, or maybe there's some body image concerns. And even outside the realm of eating disorders, even people with, other MNT or just, general health and wellness concerns, or maybe someone's experiencing any GI issues due to stress. Like we talked about, stress is so impactful, more than
Yeah.
people or maybe any metabolic conditions where shame could potentially impact care. So it's really just a great approach for all.
Yeah, definitely. And this type of collaboration and inclusive care, are really important to address all of the issues that you just mentioned. And that inclusive care really starts with respect and curiosity about each person's lived experience, slowing down and asking more questions instead of making assumptions.
Mhm.
Because two people in similar bodies can have completely different experiences and histories, relationships with food and movement. Um, so I hope that, this slowing down and asking more questions and approaching things with compassion and respect, I hope that that style becomes more normalized and accessible to, people working in healthcare.
Yeah, I agree. In, dietetics counseling and, what we do at Doherty Nutrition, having that inclusive care, part of that is just creating those personalized nutrition strategies for people.
Mhm.
Kind of like you said, two people have very different experiences, and what works for one person is not going to work for another person. So really personalizing is really important. Also something that, I feel is very important is just never assuming someone's health behaviors or their health goals, especially based on their body size. Like just,
Mhm.
you know, let everyone tell you like what are they here for? What are they wanting? Just never wanting to make that assumption. Always asking for permission before discussing weight or numbers or calories or anything like that. People may think it's very standard in, dietetic care to just discuss weight and numbers, but it's something that I really like to make sure that my patients and clients are comfortable with before we dive into. And then kind of like how we've just been talking about through this whole discussion is just really focusing on the behaviors rather than any of those numbers.
Mhm.
Because when we improve the numbers as when we improve the behaviors like we talked about, that can improve all of the health markers regardless of what any of the numbers do.
Yeah, definitely. I think similarly, in the therapy world, we address that internalized weight stigma, support body neutrality. So not focusing on the number, focusing on the behaviors and exploring how, diet culture and fat phobia impacts mental health. I've had so many clients who didn't even really realize how much of their inner dialogue was shaped by diet culture until we started naming it. They'll say things like, I just thought that that's how you're supposed to think, or I thought everyone talked to themselves like this. And once we started to like externalize those beliefs, to like see them as learned rather than inherently true, it really does create space for change.
Yeah.
And that doesn't mean that like clients suddenly love their bodies overnight, but it often allows them to relate to themselves with a little more, neutrality and compassion and flexibility. So those shifts can have really meaningful impact.
Yeah. Yeah. Ultimately, I think inclusive care means just meeting people where they are and supporting their individual goals and values and supporting their journeys along the way. Um, and that's just something that's so important that we can all, as providers, strive for.
Yeah, definitely. And to sort of, start wrapping this up and bring it back to our initial point, health is not a one size fits all. The more we normalize an inclusive and compassionate approach as the standard, the better the patient or client experience and health outcomes.
Yeah, absolutely. And when dietitians and therapists work together, we're able to support both the physical and the mental health aspects of health.
Yes. So if you're interested in learning more about health at every size or working with providers who take an inclusive approach to care, we encourage you to explore our resources and connect with professionals like us who align with these values. Our DMs and inboxes are always open.
Yeah. Thank you guys for joining us for this conversation. Avni's information is going to be linked in the description below. And if you guys have any questions, like she said, you are always free to reach out and DM us.
Thanks, y'all.